As mentioned, polio generally tends to not have or show any signs or symptoms in people infected. This allows polio to be transmitted from person to person much more easily because people who don't know they're infected tend to go to work or school and continue to engage in regular activities, not realizing that they're spreading the virus to their friends and family. However, in a small number of cases, there are some very serious side effects. This was made somewhat famous in President Franklin Delano Roosevelt. FDR was paralyzed as a result of polio. Polio is transmitted, as mentioned, by the oral fecal route, but can also be transmitted with indirect contact from infectious saliva or fecal material, or contaminated sewage or water. Polio replicates in the tonsils and invades the bloodstream from there. If the polio virus is able to invade the bloodstream, it can make its way to the nervous system, where it causes these very serious symptoms. Replication in the spinal cord and nerve cells causes paralytic poliomyelitis, resulting in severely deformed limbs. Paralysis usually occurs within a week to a few weeks from the time of initial infection, and in about 2 to 10% of cases, death occurs. Bulbar poliomyelitis is an extremely dangerous form of polio that can paralyze the respiratory system. This causes difficulty in swallowing and breathing. In the past, the way these symptoms were treated was to place a patient in an iron lung. The iron lung is an airtight metal tank that forced respiration into the patient by pressurizing air, pushing on the lungs and on the chest cavity, causing air to exhale, and then releasing that pressure, allowing the patient to inhale. There were some cases where patients would spend their entire lives in the iron lung just to stay alive. In less severe cases, patients may just spend a few hours a day. But any patient that requires an iron lung for survival also requires electric current. And in some cases where there's a power outage or an electrical failure, the patient could die as a result, as what happened in 2008 when, at the age of 61, Diana Dell died from a power failure in her home when her iron lung stopped functioning. Next, we're going to talk about airborne viral diseases. There are quite a number of these airborne viral diseases, as you can see from this chart. Almost all of them cause respiratory illnesses, are surrounded by an envelope, meaning they have a phospholipid bilayer that's stolen from the last host cell they infected. This provides an added layer of protection as they float in the air from host to host. Because they have these phospholipid bilayers, these membranes, they are considered enveloped viruses, and enveloped viruses are susceptible to the alcohol-based hand sanitizers that you may be familiar with. Some exceptions to this rule include adenovirus, rhinovirus, and enterovirus, as these cause common colds, and these common cold viruses are naked viruses in that they don't have membrane layers. So while Purell and other alcohol-based hand sanitizers are effective against the flu and some other airborne viral diseases, they are not effective against the common cold. These common cold viruses can be found in many different types. As mentioned, adenovirus, rhinovirus, and enterovirus. But within each one of these types, there are many, many different strains. So there are over 100 different common cold viruses, making this particular disease difficult to develop a vaccine and difficult to treat and diagnose. Common cold viruses are transmitted not only by respiratory droplets, but also through hand-to-hand contact or from touching contaminated surfaces called fomites, like doorknobs, faucets, furniture, and toys. Many of these viruses that are responsible for the common cold can be found in just one of the two groups, adenovirus and rhinovirus. These are the most common type of the common cold. Now, while most people don't associate the common cold with anything serious, there are some serious respiratory viruses, and this includes the respiratory syncytial virus, or RSV. RSV is a virus that is most particularly life-threatening to infants younger than 6 months of age. It is highly contagious and found all over the world. It causes bronchiolitis and pneumonia. Bronchiolitis is inflammation of small airways of the lungs. It may sound like bronchitis, which is inflammation of the larger airways of the lungs. Pneumonia is infection of the lung tissue itself, where the microbe, in this case the virus, is growing inside that lung tissue. It is the most widespread cause of respiratory infections in children younger than 6 months old, and by the age of 2, most children have already had an RSV infection and are therefore immune to it for the rest of their lives. Symptoms of the infection are fairly nonspecific, which makes diagnosis fairly difficult. They include fever, runny nose, ear infection, and pharyngitis. RSV is responsible for about 200,000 hospitalizations every year and 14,000 deaths in adults older than 65 years old. So this virus isn't just deadly to infants, but also to the elderly. The best way to prevent these types of infections is frequent and careful hand washing, because no antivirals or vaccines are available to combat this disease. A more commonly associated virus that people think of as transmitted through the air is influenza. Influenza is characterized by exaggerated cold-like symptoms and include a headache, high fever, myalgia, which is pain of the muscles, sore throat, cough, and fatigue. The important thing here to recognize is that there is a very big difference between the common cold and the flu. The common cold tends to not have headaches, not have muscle pain or body pain, and especially important, not have a fever. Unless you have a fever, it is very uncommon for you to have the flu. So most people who say, I'm sick with the flu, are really just sick with the common cold. The flu is very debilitating, and it really wipes you out where you can barely get out of bed. You are typically back to normal within a few days with the common cold, but influenza usually takes a week or two. The reason why it's so important to recognize these differences is that the flu can be deadly, whereas the common cold is generally not. Most people exaggerate their symptoms and tell their friends or coworkers or boss or teacher that they have the flu, when in fact it's just the common cold. Of the flu, there are a few different types. Influenza A is the type that causes epidemics and pandemics and can spread around the world pretty easily. Influenza A can spread around the world because it doesn't just have a human reservoir. It can also be infectious to various animals, including birds and pigs. Influenza B is less severe and only causes epidemics. mostly because there is no animal reservoir and it's just spread person to person. Influenza C doesn't even cause epidemics and produces only mild respiratory illness in people. When we have influenza vaccines, the flu shot generally is just designed to combat influenza types A and B. Influenza is transmitted through the air. However, it's also transmitted through fomites or contact with contaminated materials. The incubation time is fairly short, only a day or two. And so if you do come in contact with anybody who has the flu, you'll know within a couple of days whether or not you caught it as well. Conditions of colder temperatures in the air, low humidity, crowding and close contact allow for an increased rate of transmission. This is one of the reasons why the flu is much more common in temperate regions like the United States and Europe in the winter. However, in tropical locations, there is no flu season, and the flu is transmitted equally as commonly around the year. Every year, people who are 65 and older and other high-risk groups, including the very young and pregnant women, are urged to get a flu shot. Why do we need to get a flu shot every year? There is evidence that, in fact, the flu shot does last for your entire life. And so what you're protected from with the flu shot can protect you against that flu strain for the rest of your life. The problem is that the flu virus regularly mutates or changes from year to year. So every year you get the flu shot, you're actually protecting yourself against a new and different type of flu, making your immune system stronger and stronger as the years go by. The way that the influenza A virus changes or mutates to allow it to cause new infections year to year, despite the vaccine rates, are reliant on two molecules in the membrane of the flu virus. These two molecules include hemagglutinin, H spikes, and neuraminidase, or N spikes. These two spikes are required to infect the next host cell, and both of these serve as what are called virulence factors then, to allow that virus to become a pathogen in the next host. The H spikes of influenza virus attaches to a host cell receptor called sialic acid. And this is present on the cells that line your respiratory system. The N spikes play a role in the last stage of viral replication, release of new viral particles, or new virions, allowing for the spread of that virus to other cells. Both of these spikes are molecules that your immune system can respond to, meaning they act as antigens and provoke production of antibodies in your body. That is why these two spikes are associated with the development of vaccines, because the vaccines can also initiate an immune response as well. Unfortunately, the spikes have many different types. So there are 9 different types of N spikes and 17 different types of H spikes, allowing for 153 different combinations. In addition, these different spikes can be adjusted or mutate slowly and change in little increments over time as well. In the next lecture, we're going to talk about how this relates to antigenic shift and antigenic drift.